Just ahead on this week's edition of Being Well, we'll be talking about anxiety and depression with therapist Dick McDade from Sarah Bush Lincoln Health System. We'll discuss the signs and symptoms of each, and Dick will also provide some advice on how family members can help their loved ones cope. That's just ahead on Being Well, so stay right here. Dick, thanks so much for coming on Being Well. Today we're talking about anxiety and depression. Let's start our discussion by give us a general description. What is the difference between anxiety and depression? Because they often sometimes go hand in hand.
Yeah, and they do. And, you know, they're one of the what we would call dualities of life because, you know, we talk about the chicken and the egg and love and respect and the horse and carriage. Well, it's depression and anxiety. Very seldom do you clearly have one or the other. And because well, for one thing, the symptoms overlap. And so you might come in feeling depressed, but you can then realize that, hey, there's a lot of anxiety there. And both can contribute to each other.
Okay.
And so they are distinctly different, but at the same time, they overlap a lot.
Well, let's talk about some of the symptoms. Let's start first with general symptoms of depression.
Okay. Now, we have, psychiatry has what we call a diagnostic and statistical manual, and that's kind of our reference book. And they started that like almost exactly 60 years ago.
Okay.
And they started it, and we refer to it as DSM-1, and now we're up to 4, and 5 is coming out almost exactly a year from now. So it's a big deal. It's very important, and it unifies, you know, as much as possible our diagnoses, you know, across the board. And so when you talk about depression, it's actually an affective disease, and affective meaning mood. So it's a mood disorder. And then basically when it comes to depression, you know, we have major depression, and that's what we call it. And then we have more or less a mild depression, which is dysthymia. And then we have good old bipolar, and everybody knows about bipolar. And basically, that's when the depression creates changes, you know, in your mood from manic, which means hyper, and hypomanic, which means, you know, more depressed, and, you know, and sometimes even more depressed than major depression, okay? And so those are the 3 basic categories. Then when it comes to anxiety, you know, we have a number of things that are inclusive under anxiety, such as phobias, which are fears. And then we have SAD and GAD, and SAD is seasonal affective disorder, you know, and then we have more commonly diagnosed general anxiety disorder. And then we have social anxiety, panic disorder, and agoraphobia, which is basically, you know, people isolate themselves because they're have difficulty, you know, going out among the rest of the population. And then good old OCD, obsessive compulsive disorder. And then actually PTSD is under that. And I spent 20 years in the Air Force as a mental health officer from 73 to 93. And so I saw a lot of PTSD because that was the end of Vietnam.
Right.
And I even had the blessing of talking with a lot of the people coming back from Hanoi Hotel and talking to them about, you know, what they went through.
All right, Dick, how do people know if they're sitting at home that maybe I have depression, maybe this is something more than just general sadness? How do you diagnose general depression?
Well, for the person sitting at home, they will begin to recognize, I'm just not as happy, upbeat. I'm sad more often than not. And so I think realistically we can tell that we're not functioning like we should with our mood.
Right.
And then most people will begin to ask themselves, what's going on? And probably the first line of defense is a family member or a friend. And at that point, the family member and or the friend could say, maybe you should talk to your medical practitioner. And sometimes they'll follow up on that. Sometimes they have to be given a push. Sometimes somebody has to go with them. And some people will automatically think about their minister, and sometimes talking to a friend and that friend acknowledging, I've had those same kind of feelings before and this is how I dealt with it. But if those feelings persist and talking with friends and family, doesn't get it, then that's the time that they should talk to their medical practitioner and or make a referral to one of the local mental health outpatient organizations. And but again, it's ultimately the person that has to make that decision.
All right. So let's talk about anxiety. We all get anxious about events coming up, and
Right.
We all have sleepless nights. When do you look at anxiety as something more than just, everyday sort of general worry?
Right.
When does it become really a problem?
Yeah. Again, when it interferes with your functioning, because people suddenly can't go to work, even though they might have worked there for months or years, but this anxiety, kind of sneaks up on you sometimes, and pretty soon, they find reasons to call in sick, or they can't make it for some other reason, So when the answer to that question is when it begins to interfere with daily functioning. And so again, at that point, then the first line of defense would be a family member, or a friend.
Okay. Certainly family history plays a role in anxiety and depression. How big of a role do you think it plays?
Well, basically there's two causes. I mean, if we look at it as the big picture, either anxiety or depression, it's basically the environment or there's a chemical imbalance.
Okay.
And so first of all, you look around in the environment and say, this is the cause of my depression, or this is the cause of my anxiety. And I tell people all the time that life is like walking up a down escalator. And so you can you could never quit or it'll bring you down, whatever that means, professionally, personally, or mood-wise. So we have to keep striving to, and so consequently, anxiety or a mood disorder can take over, So it's again the responsibility of that person to recognize when it's interfering with my activities.
So if someone has been diagnosed with either anxiety or depression, is it something that they're automatically going to have for the rest of their life? Or can it be something that you get over in time with medication and talk therapy?
Right. And basically the answer is both.
Okay.
Because if you're on the right medication and there is a chemical imbalance as the cause or etiology, then and I don't know whether it's professional for me to say. But I look at when the psychiatrist began to figure out what combination of medicines, I call that a recipe. You can go home and make a casserole and it's a certain recipe, but even though you follow the recipe, it doesn't work as well for you as it did for good old mom. Well, in a way it's similar. When you go to the psychiatrist, he's thinking about this and that, and he also he gets the extensive background and psychosocial background, and so he's determining what combinations, and again then we're talking about psychotropics, which is what I refer to as mind-altering medications. And
which sounds a little scary.
Yes.
When you bring that up.
Exactly. And so, but the three main psychotropics are the antidepressants, the antipsychotics, and the anti-anxieties. So, and then we have mood stabilizers, and we have stimulants such as Ritalin and that kind of thing. So that's what's happening at that point, they're making that decision, But a lot of times when people are depressed, they want to see a therapist. They want to talk to somebody. So then we go down the list of possible people that they can talk to, and we have various professions: psychologists, social workers, counselors, marriage and family therapists, ministers, and so at that point, and I've had many come in and said, I don't want any medicine. All I want, I feel like I can talk this through. And at some point, if that isn't working, then we should make a referral to their psychiatrist. Now, and I have to add to that, a psychiatrist is a medical doctor.
Okay, I was going to ask, how do psychiatrists, psychologists, therapists, family practice people, how does that, who does what?
Generally, most therapists have to have at least a master's degree. And then a clinical psychologist, PhD, they have a doctoral degree in psychology and clinical psychology, and they're licensed as well as the people like myself at the master's level. And then none of us as yet, and this might be spotty, but none of us can prescribe medicines. I know they've been kicking that around from state to state to have psychologists, PhD psychologists approved for doing that. And I'm not up on that status, so we won't go there. But then the top level is the medical doctor who specializes in diseases of the mind.
Which is a psychiatrist.
Psychiatrist.
All right, I got you. Are depression and anxiety considered mental illnesses? Because there is a stigma with being, I have something wrong with my brain. Do they fall into that category of mental illness or not?
No.
And I know some people might object to that, but when you go through the DSM-4, you have these main categories: mood disorders, and but then you have the mood disorders as well as psychotic disorders. So to me, when you have a diagnosis of schizophrenia or some type of psychosis, schizoaffective or something, then that would be in the realm of mental illness. But again, and that takes me on to another thing. A lot of times when people first come in to talk to me, I do what I call normalize. And I simply say, hey, you should be depressed. Look at all what's happened. Somebody ran over your favorite dog. Your grandmother died. You got in a wreck. The car broke down. You couldn't afford to fix it. That's the environment. And we don't always have control over our environment with those kinds of things. So, hey, that's normal. And you'd be surprised how many people just kind of go, I'm normal, whatever that means, by the way.
So does it seems to me, and as you talk to people, that I mean, this is generalizing, everybody seems to be taking something these days. Is it true that a lot more people are being diagnosed with anxiety and depression now than maybe 20 years ago? Is it on the increase, or are we just becoming more aware of the illness and not suffering with it as maybe people did 20 years ago?
Yeah, I think your observation, the latter thing, is what's going on, because we have much more heightened awareness of mood disorders and anxiety, and you know, the fact that we've had two fronts for the military, you know, Iran and Afghanistan. We have a lot more PTSD, and there's a heightened awareness about that.
Right.
But you know, if we've ever been in a serious accident or a serious fall or a serious illness, that's PTSD also, you know, and it creates a lot of negative associations, and you know, and that's another aspect, you know, of human nature, is that we have these associations, you know, negative as positive, you know, and we have lots of positives, and we kind of take those, you know, in hand. But one of the most common, we're tooling down the highway, the interstate, feeling kind of bored. We turn on the radio station, and there's our favorite song that we had in high school. So back we go, if that's a positive association, by the way. And so back we go, and we kind of, you know, recall and have memories about that. And that's a common positive association. But for people with PTSD, you know, especially, you know, being in an accident, sometimes it's difficult for them to get back behind the wheel of the car, you know. And and they have a lot of negative associations. So, yeah.
So let's talk about, give us some advice on what family members can do, especially if you're maybe a spouse and your husband or your wife suffers from anxiety and depression and you don't. It can probably be frustrating at times. What advice do you give to family members and spouse to help the person who's suffering from depression or anxiety get through maybe some of those more difficult times?
Yeah, it's a good question, because again, you know, as we talked earlier, they're the first line of defense for this, and then the first line of support. And so, you know, to keep it as simple as possible, the very first thing is show that person compassion. The family members show the person that's having the depression compassion and offer to help. And then patience. You have to be patient with them. And many times, you know, I think all of us have heard our grandparents or parents or our spouse say, just buck up, you know, you can do this. Yeah. But if it's a, you know, a depression or mood disorder caused by a chemical imbalance, it isn't that easy.
Right.
You know?
I mean, no one really wants to lay on the couch all day and feel that way. They just can't get off the couch. You'd mentioned that it is a chemical imbalance. Is all depression and anxiety caused by some brain chemical imbalance?
Well, you know, that's a good question too, because many years ago, 20 in fact, we had a new psychiatrist that just came out of his residency, and he said, Dick, the way of psychiatry now is chemically or biochemically, and there is a chemical reason or involvement for everything we do, whatever because the chemicals that we're talking about are in the neurological system, and of course the boss of the neurological system is the brain, so it's the brain chemistry. And we've had some fabulous research through the years. And so no matter what we do, whether it's positive or negative, or whether it's good or bad, or whether we're feeling good or feeling bad, there's a chemical reaction. So with that in mind, Psychiatry is attempting to, again, to get that recipe of medications that can enhance that chemical functioning in the neurological system.
Okay. Let's get back. We were talking before I interrupted you about, support for family members. You had said, show compassion, be patient. Are there other things that family members can do to help their loved one who suffers from depression and anxiety?
Yeah, get them to their medical doctor or practitioner, or get them to the local outpatient therapy clinic, or sometimes, if they're having feelings of suicide or just ideas of suicide, take them to the emergency room. And that brings up the fact that, we have 24-hour response to people with the more serious anxiety and depression, In this area, we have the emergency room that's open 24 hours a day at the Sarah Bush Lincoln Hospital, and it's easy to go there. Well, it's reasonably easy to go there, and easy to call there. And then, they would send out an ambulance if need be, or the family member can take them, Then we have a 24-hour emergency called a crisis line. It's run by Regional Behavioral Health through the local mental health clinic in Mattoon, which is LifeLinks.
Okay.
And the number for that is 866-567-2400.
Okay, and that's a free service, correct?
Yes, absolutely.
Okay. And I'm assuming other counties in our viewing area probably have similar things, just to look up, the phone book to find those crisis lines.
Yeah, but you'd be amazed that what area Sarah Bush has to encompass in what we offer, and especially in mental health. So we have basically a 7-county area,
okay,
and 5 or 7 county. I'll get in trouble for that, I guess. And that's called our catchment area.
Okay.
So we take patients, from Clark and Edgar and Cumberland and Moultrie and Douglas, and well, maybe not Douglas, but they still can come. That's the point,
Okay.
And
Well, we want to close here. We've got about 3 minutes left, and you're a counselor and you see people all the time, and I know you have several, we'll just call them sayings, and different things that you use in your practice to get people to start thinking about their life, or just to think about things in general. And I want you to share a couple of your favorites that might resonate with several people, whether you're dealing with depression or anxiety. I think there's some good things to think about as we go through our day.
Well, Lori, I try to make things as simple as possible, And, I was also thinking about this, and I'll get to that. Now, I know I'm running out of time. But, when you think about depression and anxiety, if you simplify it to a single word, one is up and the other one is down. And when we're depressed, we feel down, right? When we're anxious, we're really hyper anxious, so we're up, and we say, hey, why am I so uptight? Up and down, okay? But I developed a lot of sayings through the years, and and normalize was one of them. The walking up the down escalator is another one, and I'm a eclectic kind of therapist. I dabble with all the kind of different, but cognitive behavioral therapist probably is as close, but I'm eclectic, and so one of my approaches is always to give people food for thought, and that's what these phrases do, and we can't go through all of them, but
pick out a few of your favorites.
Yes, let me see if I can do that real fast. A lot of people that have behaviors that get them in trouble, And we're human beings. We like just to be an automatic, like an automatic transmission. You turn on the key, step on the pedal, and you're out of here, right? Well, when those automatic behaviors get you in trouble, then you got to shift back to manual.
Okay.
You got to have a clutch. And a clutch in one case is what we call PPR, and that is pause, process, and reply, rather than do it automatically and get yourself in a bigger hole, okay?
That's a good one.
And so I tell people, hey, let's shift back from automatic into manual, and you'd be surprised how many people can really cling on to that, and they look for that clutch, and they got to push that clutch in before they shift from first to second.
It goes,
to fifth. Exactly, yeah. And you know, I use the poem Footprints. You know, that's such a neat one. And I had a saying when I was in the military, and that I had it on my wall, and it goes like, do not follow, for I may not lead. Do not lead, I may not follow. Just walk beside me and be my friend.
That's a good one.
Yep.
You have a few others that we can leave with for today that maybe we can all
Let's
think
see.
about?
Yeah, I got some good ones. I used one recently because I see a lot of people that are down on themselves. Their self-image is not all that good, and I tell people, you know, I might not be the best, but nobody's better. And I had a gentleman that was unemployed, looking for jobs, and he used that in his interview, and they hired him.
Well, there you go.
and I just saw another one. Oh, and for the non-assertive people, you know, my phrase to them is, we only oil squeaky doors. So if you need some attention, if you need some help, start squeaking, then people will pay attention to you.
Well, that sounds...
And women tend to be the worst about that. Sorry.
That's all right. Well, Dick, thank you so much for coming
You're
in.
welcome.
I really enjoyed our discussion, and I hope a lot of what you have talked about has helped some people to either recognize maybe, hey, I'm not feeling quite right, and to seek some help either through their general doctor or psychiatrist, psychologist, or a counselor such
Right.
as you. Thank you so much.
You're
Appreciate
quite welcome. Thank you.